Welcome back. The million-dollar question is, when will we see the end of the COVID-19 pandemic? The virus continues to wreak havoc globally. Now it's claimed over 2 million lives. Mckinsey released a series of scenarios of the probability of the pandemic in different regions recently. Well, to discuss this, we join now by Kannan Lakmeeharan from the company. Kannan, good morning. Thank you very much for your time. I saw this article. McKinsey writes a number of updates regarding COVID-19. I saw this article last week saying, when will the COVID-19 pandemic end? I said, wow, I'd like to know an answer to that, like millions and millions of people around the globe. This particular one is focusing on the US and the UK. And you use the word normalcy in the article, that you're expecting those two Western countries to transition to normalcy in the second quarter of 2021. But there are risks to making such a statement in the sense of the progress of the vaccine rollout in those countries. And of course, we've got these new variants now of the coronavirus.
Yes, thank you, Dan. Good morning to you and to your listeners as well. And thank you for having us on this very important topic. As you said, these were scenarios, not predictions. I wish I had a crystal ball, and I don't. But I think it's important to understand the scenarios to help with planning and also to help, industry, the commercial industry, as well as government and all of us to kind of think about how we prepare. Before the variants came on, we thought, if you get to herd immunity, you need to vaccinate up to 60% of the population. I think we're also starting to learn that you need to get maybe even as close to 80% of the population vaccinated if you want to achieve herd immunity and have some resistance to variants. And that then pushes kind of the return to normalcy, possibly even to third or fourth quarter of 2021 in the UK and US. So these are things that got to watch very, very carefully.
Yeah, and what is normalcy?
So in our view, normalcy means that, with one is you don't ignore public health precautions, wherein masks could still be part of normalcy, social distances of some sort, hygiene, but it allows us to go hopefully through our day-to-day lives, going to schools as we want, going to recreational areas, going to work, and still taking care. And we probably have to start thinking about what does living with the pandemic, living with the virus mean? Do we get into the risk of still endemic outbreaks, maybe yearly vaccinations, etc.
Yeah, but to achieve,
these are things still to be discovered, but that's what we mean.
Yeah, but Kannan, to achieve that kind of normalcy you're describing and herd immunity, there unfortunately remains a large number of uncertainties, that could delay that, like the pace at which the vaccines are rolled out, you get 2 doses or not 2 doses, and these variants.
Correct, 100%. I think those are still risks that we need to monitor. It's still incredible what has been achieved. I think we've got to acknowledge that. For the vaccines to come out so quickly, for the global health response that we're seeing, it's still incredible, but a lot needs to be done. So I agree with you.
No, Kannan, now finally, although from the scenarios that you are painting as McKinsey, the one that I read, herd immunity is expected to be achieved by the end of this year in developed countries. What about us? South Africa, our first batch of vaccine is still in the air as we speak, flying from Dubai, coming here.
Yeah. Look, we're not sure yet. We haven't, as you've seen, published our view on the rest of the world, including Western Europe. That will come out as we start to understand the pace of vaccine rollouts. And it is, I think the government and generally the WHO is trying to do the right things, trying to get the COVAX program going, plus other initiatives. But it is concerning that, we do need to ensure that there's a fair distribution of these vaccines, because this is not a localized problem, this is a global problem. But I can't give you a prediction for sure, Dan. Yeah. I think we still have to monitor.
The big question is we actually don't know when we might return to normalcy with certainty. Thank you very much. That's Kannan Lakmeeharan he's a partner with McKinsey. The big question